jaw tiredness and neck discomfort, headache. And with my 6-month checkup a few months ago, it was mentioned, and it was just something I never realized, that all these symptoms may be related to needing this procedure. And I find that I bite my inside lip, just a general tiredness in my jaw and shoulders.
Okay, do you ever notice sticking your tongue between your teeth?
Unconsciously, yes. When you mention it, I do find myself resting my tongue between my teeth.
Another question, how often do you have the headaches?
Frequently lately.
About once
Every
a day?
day. Every day.
You had a splint made, you told me.
Mm-hmm.
Has it helped your problem or made it worse?
I would say it stayed the same. I mean, I've had 3 night guards, I would say, in the last 4 or 5 years, because I kept chewing through them.
Okay.
So I just kept making it thicker and thicker, so I wouldn't chew through it.
Yeah.
So that leads me to believe I have a lot of grinding in my teeth at nighttime.
Right. Yeah, makes sense. Was the night guard hard or soft?
Hard.
Hard, and you're just punching holes through it.
Mm-hmm.
When do you recall this whole problem starting? How many years ago?
Where I started with the clenching and wearing a night guard, Swan,
Yeah.
I'd say probably the last 5 or 6 years, where it was more noticeable. And
It's getting progressively worse?
yes,
Okay.
yeah. And also just where I've become aware of the jaw being tired or almost achy, but not painful achy, like, oh my gosh, I can't tolerate it, but it just seems tired all the time.
It's ramping up,
Mm-hmm, exactly,
getting a little bit worse all the time.
exactly.
Trying to go left, and you're rubbing the heck out of your back teeth here. Should go to your canine, this little red line, and it's not doing it. It's running to the back, and there's interferences on the opposite side as well. Looser?
Yes.
How about
Yeah.
your issue on your right side? Remember you walked in saying it was kind of squishy or,
It still sounds a little bit squishy, but
yeah.
Yeah.
There's damaged cartilage over there.
You're
That's not
right.
going to change.
Okay.
This won't correct the cartilage. but-
understand. But it's not something I can't live without,
Yeah.
I can't live with.
Yeah, but what's going to happen is the muscle is going to be relaxed, so it's less likely to make it progress, and it's like a guitar string that was taut that's now loosened up. So it
I-
shouldn't be as profound a snap or pop or whatever it was doing for it.
I do notice when I let my mouth relax that my tongue doesn't seem to come forward and rest between my teeth now,
Automatically.
automatically.
Pretty cool.
Yeah, they
Okay.
seem like they meet my tongue rests where it should, back of my mouth,
Yeah.
behind my teeth.
Does it feel looser underneath your jaw, lower jaw?
Yes,
I know that's unusual, right? Question, but
I haven't
Okay.
thought about it before.
yeah. The vast majority of the adjustments I've made are on old dental work.
Huh.
Fillings, crowns, almost none of it was natural.
It just felt like there were gaps in that bite. Now it feels nice and even all the way around. That makes sense, I don't know.
Yeah, it does.
Huh. Amazing,
And the tongue,
very comfortable.
Like-
It doesn't push forward or,
just loose, right?
right.
See, and typically, this will feel more flaccid, loose
Okay.
underneath your mandible. I mean, not everybody,
Uh-huh.
but because the tongue's not having to do this thing, basically it used to shove between your front teeth to keep your back teeth separated.
Ah, okay.
Because central nervous system doesn't like the fact that there's all this excess friction
Yeah.
between the back teeth. So it shoves its own little homemade splint in there to keep things separated.
Amazing.
So now, guy in the control center realizes the friction has been decreased. He shuts down the muscle. And he tells tongue, which is 3 muscles, you don't have to push in between anymore. And all of a sudden he's been geared up for years.
Yeah. He can take a break.
He can take a break. It's been a week, so how have you been?
Great. It's absolutely amazing, the difference.
Can you describe it for me?
I no longer wake up with a headache. I don't wake up with neck stiffness.
Yeah.
I don't have tightness in the back of my neck, like I want to keep snapping it, like it's so
Yeah.
tight. Have had none of those symptoms.
Really? How about sticking your tongue between your teeth? I remember last week you had an issue with that.
Nope,
That's
have
kind of
not.
gone away.
That's gone away also.
The tension in your temples and your cheek muscles?
Gone,
Easy.
gone.
Awesome.
Amazing.
How
That's all
about
I
your
can-
hypersensitivity to cold?
Actually, I intentionally ate a fruit bar.
Yeah,
Not,
no problem.
no problems.
Whereas a week or two ago, if you'd have done that, you'd had a problem?
Yep, when you gave me the ice water to swish around, I had certain sensitivities
They're gone.
gone.
And you had no clue, right?
Nope. It's
Yeah.
amazing. I had no idea that all this was associated and
I mean, it
No, it's-
technically takes the muscles about a month to calm
Mm-hmm.
completely and lose the excess lactic acid, that anaerobic, I'm tired feeling when you work out too hard.
right.
That's what happens in the head and neck. But if you balance the bite precisely the way we do, and if you verify it with that EMG, the muscle stuff, it's like night and day over what normal dentistry can do.
Right.
Medicine
right.
can't do it. I mean, this is like
Right.
wicked stuff.
Like I keep saying, it's amazing because it was not painful, and I can tell a big difference.
Yeah.
And
You can
it
chew
was
and eat
good.
anything you want now, right?
Oh yeah.
Are you glad you had it done?
Yes. Yes.
Okay.
Absolutely.
All right, thank you very much.
You're welcome.